so many of our patients are kind of DIYing with these tools. And if we're not familiar with that, we're in a situation where they're going to say like, well, why don't they know this?
Any recommendations to how do we close this gap between what is possible and is happening out there in the field, and then actually making it practical on a daily basis at our hospitals where a lot of the care is given?
I need to make sure that when I'm building alliance with the hospital mission, so the CEO is going to like me. I need to make sure I'm going to save the money or produce a new revenue stream or make something more efficient for them so the CFO is going to like me. I need to make sure what I'm doing integrates with their current electronic health record and their system and their digital health stack so that the CTO likes me.
Good morning, everyone. Welcome to Signals and Symptom Podcast. And today is a special day. Interestingly, John Dayton is a good friend with Harvey and knows Ed, knows me, etc. But his journey is superb. He's actually a physician, first and foremost. Then he's a Stanford faculty. Then he's a practicing physician. First, take us through your journey, your life journey in terms of from a physician to faculty, to entrepreneurship, to, I don't know, VC fund founder.
Yeah, first of all, thanks so much for having me on the show. It's great to connect with you guys. Just a little bit about background for myself. I'm an emergency physician. I live in Utah. I started practicing in Utah initially. And in addition to working in emergency medicine, I like to be involved in innovation. So I was involved in getting a Utah chapter for Society of Physician Entrepreneurs off the ground. I had transitioned to working up at the University of Utah, and where I was doing research on innovative delivery models, looking at freestanding ERs, particularly those built by academic centers, and what those kind of metrics were looking like. And obviously, COVID changed everything. Fast forward a couple of years, and I was working on the Navajo reservation, which was a great experience. I felt really useful. COVID changing everything. I thought, I've been looking at doing innovation, and I've been trying to figure out how I'm gonna add that to my practice, and playing around with the idea that ER doctors were famous for burning out, and so I was looking at MBA programs, and one of my friends who was at Stanford said, we're just starting this innovation fellowship. Why don't you come join us? And very non-traditional fellow. I'd been practicing for over a decade, but I went back to school because I thought, what a cool experience. So I was in Palo Alto for 2 years. I did the innovation fellowship, and then part of that program was you can do the biodesign faculty fellowship on top of that. And they gave me money to pursue an MBA. And so phenomenal fellowship. That's been a really interesting journey. Back to my SOAP days, Society of Physician Entrepreneurs, as part of that, setting up all these pitch events. I ended up meeting the local tech transfer experts, local VCs, local angel investors. And I was invited to be part of Salt Lake City Angels. So me and 2 other physicians that were part of that group, we did a lot of digging, saying, is this a big enough need? Is this something that's going to grow? Is this something that will work? And then ended up leveraging those connections from working as an angel to working in VC. And so now I'm kind of full circle where I've been involved, but this is the first chance to build my own. So I'm in the process of raising a $5 million fund, me and my partner, Jamie Edwards. And our thesis is where I'm a physician that has experience in building effective pilots and regulatory strategy, and where he's an operator with a background as an entrepreneur in residence for startup health and with an operator in the telehealth and the RPM space. We're really focused on helping early companies make sure their idea is successful.
Thank you so much for giving this amazing journey. I'm going to let Harvey go first because he's in Amazon and Starlink may actually not go through this. Harvey, this is an amazing journey. I have so many questions, but I'll let you go first.
Well, John, thanks for coming, buddy. I always like asking the question, why? Why do you do what you do? Is it the AI healthcare? Is it the improvement of health? Is it the technology? What is it, John, that's pushing you to do all these things?
It's a great question. I think it's kind of a combination of being a physician in general and then being an emergency physician as well. I think we're kind of self-selected to trying to help people get better. And then in the ER, we see it's kind of a microcosm of the health system. We see the emergencies from every specialty. but we're also the safety net. So if something else is failing in the system, we see it in the ER. We bring care to this network. We leverage a lot of telehealth, and it's a smart way to bring several different types of acute care to a smaller community. And we feel like we utilize those resources well. And so that was some of the initial research I was doing, is figuring out, all right, is this a safe model? Can we do it? And ASAP gave me the opportunity to lead a task force on that, to say, we should standardize this. Just like we're talking about AI right now with guardrails and standards. Like at the time, it's like, if we're going to have freestanding EDs, how do we make sure that they represent the best of emergency medicine? And so that was an interesting thing to do, and then kind of change my focus as far as research with artificial intelligence. Obviously, I did not dive in to the length that Harvey had, but I realized I'm going to need to know how this works if I'm going to utilize it in practice. And so try to look at what are the resources that are online, what are the communities that are meeting, who are the experts in the space that we can follow. And so I built a big upskilling document on LinkedIn saying, hey, if you're wanting to be on top of AI, here are some resources for you. And so that's where I've been with kind of my focus of research and knowledge translation, and kind of helping build, trying to figure out the best way to provide care. I think looking at AI and some of these tools in general, I think there's some nervousness, some of our colleagues, or there's something that like there's because they think, oh, I don't know how to do this, I can't jump in. And really that's how we improve healthcare, because we see the pain points and we're the best position to say, hey, this is something that needs to be done to advance whatever process we're trying to fix.
Yeah, so I'm just going to echo what John and actually you're saying. The fact that we can now show an MVP and say to the VC or the hospital, hey, this is how it works. Now, my favorite phrase is, we don't know what we don't know. Example, in the 22, when I wrote ChatGPT Healthcare, people were like, Harvey, what the hell are you talking about ChatGPT and healthcare? Like, I don't understand. Fast forward a couple months ago, OpenAI now has ChatGPT Health as an official product. Another example, when generative AI started becoming a thing, in 23, I started showing discharge instructions using comic strips, using cartoons, and converting and helping hospitals and children's hospitals how to create this moat. So my point is, I'm now able to go to a CEO, go to a VC, and be like, look, here's how this works. Here's a real example.
That brings up another great point, because so many of our patients are kind of DIYing with these tools. And if we're not familiar with that, we're in a situation where they're going to say like, well, why don't they know this? Why aren't they adding it to their practice?
There's one thing to think of gold standard and full authority and trustworthiness, and there's one thing that they're going to use it. What the hell are we going to do? So question to John and comments on what he just said.
And so, John, you're obviously a very learned person, and you've done all these, at Stanford, you were describing all the different programs you went to at MIT, and now with the venture fund, you have all this exposure. So how does all of this translate down to the hospital? Any recommendations to how do we close this gap between what is possible and is happening out there in the field, and then actually making it practical on a daily basis at our hospitals where a lot of the care is given?
Yeah, phenomenal question. And so to speak to that, I'll kind of lean on my experience at Intermountain Ventures. And every hospital system has a set of goals that they're working on for the next year, and understanding what those goals are, and then integrating AI into that can be a big part. So, with Intermountain, a lot of it focus on this year are things like supply chain, anything transformative with AI. There's service lines that they want to improve and they want to get better. And so I think knowing what the hospitals are facing makes a big difference. And a lot of hospitals are facing the same thing. They're in a situation where they say, boy, we can use artificial intelligence to really improve these clinical workflows. We've got to make sure it's safe. We've got to make sure the companies we're working with have done pilot work, they have research, they're evidence-based, and then we can move forward. I need to make sure that what I'm building aligns with the hospital mission, so the CEO is going to like me. I need to make sure I'm going to save them money or produce a new revenue stream or make something more efficient for them, so the CFO is going to like me. I need to make sure what I'm doing integrates with their current electronic health record and their digital health stack, so that the CTO likes me. And then I got to make sure this is a need the physicians even want in the first place. So I have a physician evangelist that's going to support me. And so that's a really heavy task to think. I've got to sell to 4 different people, but you do that by speaking all their language. You got to make sure, your vision's aligned, that your finances make sense, that you're building something they want that integrates within the system. You have places like Stanford and Harvard where they're giving their kids, their students LLMs to work with for their education. But not everybody's getting that. And so you have to say, what are we going to do for the new grads versus the folks that have been practicing forever so they have some baseline familiarity with how they can use that and how they can move forward. And so I think it's really incumbent on hospitals addressing their needs, but then the specialist societies looking at that, and then companies that are coming to pitch to them saying, all right, how am I going to, meet the pain points of all these different groups? But that's how they're going to gain traction. That's how they're going to be effective.
I'm going to push back. And as you know, I ask hard questions. And basically, I said, rather than, putting money into an MBA, which was free for you, which is, again, if it wasn't free, would you do it? That's second question. And then the third point is, rather than doing this as a physician, should they actually join and then get access to real world data? So question number one, should we do an actual MBA if it's not free? Let's just be honest. If it's free, you should do it. But then the second question is, when you are looking at a VC and you're talking to Junaid Kalia and says, is it more important that he has an MBA or is it more important he has experience in a real startup before you fund a new startup?
Here's my take, and here's why I decided to do an MBA. MBAs are important for the knowledge and the network. You can get knowledge a lot of different ways, but the network is crucial. The other thing that I like about it is you can be very intentional about the MBA you do. I wouldn't recommend just any MBA. I wouldn't recommend just any EMBA. I was very specific when I looked at it. I did mine through Johns Hopkins because a lot of healthcare leaders go through that. It's very healthcare driven, and they have different subspecialties within their MBA. So I did my MBA, but I had two focuses. I did healthcare entrepreneurship, and I did venture capital. So I studied things very specifically related to what I wanted to do when I finished. And so I think you have to do the thing that's right for you. I'm not discounting, work that people do on the side. We're physicians. We're lifelong learners by default. That's what we're going to do. But I think you have to be kind of intentional about where you get that knowledge, who you're getting it with. Just one more thing to add. I really enjoy advising companies and helping them. I really enjoy working in the financial space, but I thought I want to do this better. And I feel like doing an MBA was my key to say, just like we study evidence-based medicine as we go through med school, what are the best practices for building and managing a fund? What are the best practices for advising a company? And I feel like I got a better handle on that through my program.
Absolutely love it. You're absolutely right. I do miss out on a lot of opportunities within because I don't have an MBA. So I just want to be very clear about it. So I did make a pros and cons. What I just wanted to do was that, hey, I don't want to delay 2 more years to build my startup.
So I think you have to figure out how do I reach these current goals with my current working situation too. And I think that's got to be a big question that factors into how you do it.
And that's truly important too. Like, I just wanted to make sure that you guys understand that I have now a network of advisors, like Harvey, Ed, now John. He's going to introduce me to VCs. I don't have an M&A background, so I'm going to get advisors and M&A strategists. So there's so many ways to skin the cat. Do not get hung up on specifics. Start, crawling so you can walk, and then you will run.
And I just want to say, and I've said it before in other venues, that if you are a traditional CIO, like you're talking about traditional physician, and do I get my MBA or not? On the flip side, if you're a leader in healthcare and you don't have any clinical background, you need to figure out ways to get it, and you don't have to go to med school, and that's what I did, right? And so I served 1 shift a week in the OR, and that gave me a lot of insights that I never had. I had less credibility when I was just tech, but I had tremendous credibility when people saw that I was willing to spend one. So there's stuff you could do. I just want to make sure that we share that with the audience, that they should be listening. And if they're not clinicians, they should flip it. Hey, what can I do to get closer to the clinician side as you're trying to get closer to the business side?
So now tell me your decision process when you were thinking from a fellowship, because again, the whole point is non-clinicians and clinicians to come in the innovation game. We want more people. John, walk people through not in the way that why you made the decision. More importantly, if they were making a decision, how they should approach it.
Yeah, great question. Kind of going back to something I was saying earlier, ER docs are famous for burning out. It's It's fun to be the guy that leads the trauma team on a Saturday night. That can get people a little bit depressed. And so it's kind of a thing in emergency medicine. If you want career longevity, you got to be like ER doctor plus, right? And so I'm like, I just thought to myself, what's going to be my plus? What's going to keep me into this? And I love setting up these pitch events. I love hearing about these new companies. Like something where I can kind of leverage where I see these pain points in healthcare, and I can, give first person account work. And I've realized this is something, if you're in the trenches and you're building a solution or you're funding a solution, that helps you break out of this external locus of control. To like, hey, I'm still in charge of my destiny, whether I'm an employee or whether I own my own practice. And so that's something I really like about it as well.
So beautifully said. Actually, I'm going to convert this to Ed now. Ed, as a non-clinician, if you want to become CIO of a hospital, there are so many ways to cut the threads. How would you, if you go back on your life and then sort of think about decisions, and how would you approach it if you were an 18-year-old, 22-year-old someone?
Yeah, trying to go down into the CIO path.
Yeah, as a non-clinician.
Yeah. Well, for sure, like I said, you need whatever the industry is, but obviously we're healthcare. You need to understand it at a ground-based level. So you need to take a position working in the lab, like working in radiology, work like I did. I think that's a ground that gives you the foundation to truly understand. Coming at it from a pure tech perspective, you got to have the heart. Like, what are we doing? We're healing people. We're taking care of people. So it's always important to have that clinical basis. Not everyone can be a doctor. I wasn't a doctor, but there's other things you can do, like I'm sharing, that are not hard. Anyone can do them. And so I would even recommend going in and out in terms of your career. You never want to be all about the tech because that's not what we're about. You never want to be just clinician because you don't want to ignore the tech. But it's that person like yourselves that can bring the two together to ultimately save lives and care for people in the worst times of their life.
I'm going to ask two very specific questions. You're going to just say very one line answers, all three of you. Number one, are entrepreneurs born or built? Is this a genetic or an environmental factor? That's number one. And then number two, my prediction is that primary care physicians are going to go away. I don't know, 1 year, 3 year, 5 year, 10 year, because of AI, it is going to go away. What is going to replace it?
I think some people are born salesmen. I think some people are born problem solvers. But one of the reasons that I like the training is because anybody can learn best practices. Anybody can learn ways to move ahead. I think that AI is going to enable them to increase and enhance their role. And what I mean by that is I think AI is going to allow them to kind of free up all the administrative things that they're not getting paid for, to go back and be, the quarterback for patient care. I think future practice is going to involve, your primary care doctor. I think everyone's going to have like agentic AI tools, maybe like a physician AI that's involved with their care. But I think AI is actually going to enable them to enhance their position rather than have it be eliminated.
So I'm going to take a hard stance. I won't be wishy-washy. You're born with certain traits to want to lead, to invent, you're born that way. Oh yeah, agents all the way. Yeah, and within years.
I have a whole talk on this actually. It's actually both. There's some genetic components where we actually do have some genes that push us to be entrepreneurs and we are risk takers and whatnot. The environment will push you, and there's simple examples. And then the second question, I actually am with John. I call it the great shift. And in that great shift, we're going to see different roles of how we practice medicine. And the primary care physician will be able to start doing medicine in a different level because of AI.
And I truly believe that we're going to see the primary care going to AI plus APP or physician extenders, while physicians are going to move towards higher level of care. And hopefully it will bring both better care and everything. I'm so grateful to everyone, especially John, for joining us. Harvey from Amazon, and Ed, finally we're back in Dallas. Let's grab a steak together.